everyone, my name is Lucy Rangas, a caregiving student. In this video, I will demonstrate vital signs on an infant. So let's get started. When assessing vital signs of an infant, make sure that the infant is calm or resting. First, we're going to take the respiration, followed by the heart rate, the temperature, the length, the weight, the head circumference, and then the chest circumference. Before you assess the infant vital signs, make sure that you gather your supplies. You are going to need the infant size stethoscope, followed by the measuring tape, a thermometer, a scale, and a watch to count. You want to make sure that you sanitize everything that you're going to use on the infant before and after use. Of course, wash your hands first with soap and water before we begin. First, we're gonna take respirations. We do that first while the infant is lying here, nice and calm, so we can get accurate reading. So before we even start respirations, we're gonna check the infant to make sure there is no respiratory distress. So, we look at the nose if there's a signs of nasal flaring. So, there's no signs of nasal flaring. And then next, check the chest if there's retractions. So, there's no sign of chest retractions. In addition, check the skin tone or color of the skin if there's signs and symptoms of sinuses. So, there is no signs and symptoms of sinuses. The normal respiratory rate of an infant is about 30 to 60 breaths per minute. To count respirations, what we're gonna do is count for 1 full minute. The rise and the fall of the chest. The breaths of an infant seems way faster than to adults. So, let's start counting. 1, 2, 3, 4, 5, 6, 7, 31, 32, 33, 34, 35, 36. So, the respiration rate of an infant is about 36 breaths per minute, which is normal. And then, we document that number. To count the heart rate of an infant, you want to make sure that you're using the appropriate size of diaphragm or the bell. The normal heart rate of an infant less than a month is about 100 to 190 beats per minute. Then after a month, the normal heart rate is about 90 to 180 beats per minute. To count the heart rate, we're gonna use the apical pulse and not the radial pulse. So we locate the apical pulse. So here is apical pulse. And place the stethoscope here and listen the beats for 1 full minute. So the heart rate is about 130 beats per minute, which is normal, and we document that number. To check the temperature in the infant, we're gonna check it via auxiliary rope. We're going to place a thermometer in the infant armpit, and we're going to use a digital thermometer. A normal temperature of an infant is about 97.5 degree Fahrenheit to 99.3 degree Fahrenheit or 36.4 degrees Celsius to 37.4 degrees Celsius. To take the temperature, we're going to turn on the thermometer. And then, place thermometer deep in the armpit and wait for the beep. And it's done. Read the temperature, and it's about 36.6 degrees Celsius, which is normal. Document the temperature. To attain the infant weight, we're going to remove the infant clothing and soiled diaper. A dry diaper can be used. We're going to place the infant on the scale and attain the weight. Here's the infant weight. It's about 10 pounds and 2 ounces. Then, document that weight. And then, we look at the infant previous weight, and it's about 8 pounds at birth. Now, at this 2 week of appointment by weight, it's about 10 pounds and 2 ounces. And that is very good weight gain from their birth. To measure the length, what you're gonna do is to lay down the baby on the surface, and then you will need a pen for this. So you may need someone's help to help you measure the length of the baby. So we're gonna measure this from head to heel. So hold the baby's head and mark like this. And we're going to extend the baby's leg and mark his heel. So we're going to gently lift up the baby, and so we can measure his length. So these are the marks, and we're going to measure this using tape measure. And we're gonna measure this in inches. The normal length of an infant is about 18 to 22 inches. So the infant length is about 20 inches. Which is normal, and we're going to document this length. To measure head circumference, what we're gonna need is a measuring tape. And you may want that measures in centimeters. A normal head circumference of an infant is about 33 to 38 centimeters. And what you're gonna do is place the tape measure around the largest diameter of the head. Gently lift up the head and place the measuring tape around his head. The head circumference is about 35 centimeters, which is normal. And we document that number. Measure chest circumference. Again, you will need a measuring tape. And you may measure it in centimeters. You're gonna take it and use the nipple line as a guide. And this is about 34 centimeters, and this should be about 1 to 2 centimeters less than head circumference. And document that number. And that ends the infant vital sign.